Hey y'all, welcome back to my channel. It's your girl Kyla Nicole here. I'm back. It's been like 4 months since I've done a video. Life be crazy. Life spirals out of control. Nursing school is crazy. Like, life just be going, okay? So I'm just back. I wanted to do like a quick video and do how to survive funds and health assessment. Again, if this is your first time watching, I am a nursing student. I attend Chamberlain University and I am considered a junior. A little bit about my nursing school journey. I definitely went to like my local college and I took majority of my prereqs before entering into the nursing program last year. I just completed my first year of nursing school. This past, when I just finished last week or whatever, I started nursing school with Chamberlain May of last year, in the middle of the pandemic. So, yeah, so I just completed, with Chamberlain, they break in health assessment and fundamentals into 2 parts, and I just completed both. I will be taking med-surg and pharmacology starting next week. So I just wanted to come back and just kind of do like tips or like how to survive funds and health assessment. So fundamentals of nursing, first of all, is basically just what it sounds like. Your foundation, like your basics, your basic skills, like your trach care, your Foley catheter inserts, IV insertions, NG tube placements, vital signs, simple as that. And then like basically knowing like how each system works, knowing about pain, knowing about the older adults, knowing about sleep in humans, and like how each of these aspects like occur in life. Like vital signs are different with each stage. Like there's a normal for each, like the infant, the child, the adolescent, the adult, the older adult. So basically just knowing your foundations of medication administrations, all of your skills, and basic like patient care. And then health assessment is exactly what it sounds like. Your assessment of the patient, your head to toe. So if you want to know how to survive nursing school with fundamentals first and health assessment, how to get through that, if you're a beginner like me, go ahead, continue to watch, check me out. All right, so basically my first thing is I'm gonna start off with surviving health assessment. It depends on what kind of learner you are. Some people are visual, like they need to visualize things to have like picture, like mnemonics or picmonics, to remember things. Or some people need to like read. I'm more of like a reader. I need to like interpret that information, read it over and over, like a mnemonic or something like that. Or you're a listener. Some people do better by listening to lectures and stuff like that. So basically it depends on how like you interpret your information. So for health assessment, I know what really helped me was watching the registered RN. She is the best. Like her videos with her assessments on how to do like your abdominal assessment, your cardiac assessment, your respiratory assessment, your eye, your neuro. She has individual videos, short and sweet, simple, basic, to get like you to learn how to do your assessments. And I know with my school you have to record yourself doing an assessment either on yourself or on a patient, on a live patient or whatever. And just by watching her videos, I'm like, oh, it like basically wraps it in. Everything that you learned in your lecture and in your lab, it all brings it all together. So I definitely like watched her, review her videos, the registered RN on YouTube. You can Google her. She also has a website too that can help you with like your nursing care plans as well. That's definitely another tip that you need to be looking at. So like the why are you learning how to assess? Like what are you assessing? with this patient. And then also you need to practice your skills. Like literally when you're sitting here, you're chilling with your stethoscope, you're hungry, you feel your stomach rumbling, grab your stethoscope, go ahead and start listening to your quadrants, listen to them, and you're gonna know, oh, those are hyperactive bowel sounds, or no, they're normal active, or they're hypoactive. Your heart, listen to your heart, familiarize yourself. Okay, aortic, pulmonic, Erb's point, tricuspid, mitral valve. Go ahead and practice on yourself. Upper lobes, lower lobes. Listen to yourself. Familiarize yourself with what is the normal for you to listen to on your assessments. So that was definitely a key. As far as like the lab portion of it, definitely is to practice. Like it literally, it's gonna weigh on you that you gotta do these videos, or that you gotta go to your class and go in front of your instructor and do these demonstrations. But if you literally practice, stand in your mirror. Literally, I bought the little sticky notes or whatever, little dots, and I placed it on, okay, so my aortic goes here, my pulmonic goes here, my Erb's point goes here, my tricuspid goes here, my mitral, and I literally kept them on my skin, and I just listened, familiarized myself. Okay, second intercostal space, aortic, second intercostal space, pulmonic, third intercostal space, Erb's point. Like you have to sit here and practice. You need to know, because this is going to be your basic period. Every time you assess the patient, everybody knows. If there's anything ever wrong with the patient, assess. The first step in the nursing process is assess the patient. So practicing and like watching, like I said, the registered nurse RN videos definitely is very, very helpful. Also, for the lecture portion, you definitely need to know what your normal is for your patient, whether they're an infant, a toddler, a child, adolescent, adult, or older adult. You have to know their baseline of your patient when you're studying, because that's what those NCLEX questions are going to ask you. Oh, you have a 78-year-old male. What type of hearing loss? Is it presbycuspis, presbyopnia? They're literally you need to know these terms. So know your baseline. Like, oh yeah, I know that an older adult, they but like it is normal for them to have some high-pitched tone hearing loss. Like you need to know those things. I know as a child, they're gonna have some lordosis because their abdomen is gonna be more protuberant. Yes, I'm gonna know this. So when you're studying, definitely know your baselines. What is your normal for your patient? And then also you need to know what is abnormal that can occur with this age group, which is common. That's definitely a suggestion. Like when you're studying, making your study guides, you can it depends if you're like a visual, do you need to make a chart? Like with age group, with the eyes, abnormal, normal, with the ears, abnormal, normal. Make a chart if that's what helps you. Or if you're like more of a word for word, I literally will go by each system, and with the child, normals, abnormals, color coded. If you have to color code, the normal is blue, the abnormal is red. You're gonna remember, like when you're taking that test, you're gonna be like, this is in red, which I know is abnormal. Which age group is this? Which system is this? Color code your systems. So that's definitely another tip for you, is to, when you're organizing your information about like each age group and which system, color code it, because that's you're gonna remember that on the test. When you're taking your test, it's gonna look familiar to you. Definitely familiarize yourself with each system. As far as virtual learning, I can definitely say it's benefited me so much. Like I get to rewatch lectures. I just can't even imagine Like, if I was normally, this is like in person, like I would definitely need to record the lecture so I can go back and at least listen. So the recorded lectures are definitely beneficial. Literally re-watch the lectures. Like, I don't care that your lecture is 2-3 hours long. You need to be letting that lecture play on your iPad, on your phone, when you're driving, or when you're doing homework, studying. Let it play in the background, because like I said, you need to familiarize yourself with this information, because it's not gonna go away. Everything you learn in funds and health assessment is not going away. It's gonna be here. It's gonna be here. Those ethical terms, they're gonna be here. Their nursing process is gonna be here. Nursing diagnosis is gonna be here. It's just not a let me get this done and pass. No. It's not going nowhere. So that's definitely one thing you want to do, is familiarize yourself. So you need to choose, or not choose, or kind of learn yourself. Figure out how you're going to familiarize yourself with this information, not just learning it to get by. What is going to help you remember this? So like rewatching lectures was good for me. During lectures, I definitely printed out my PowerPoints. Well, actually, you can either print out, but I'm an electronic nursing student, so I definitely have GoodNotes. So I downloaded my PowerPoints onto GoodNotes, and I took notes on the PowerPoint slides. Going along with the PowerPoint with your teacher is definitely very beneficial. Don't just sit there and listen. You have to take notes. Like, that's just not, I don't know how people just listen to lecture and not take notes, because you're gonna want to remember what the teacher really spoke on. That's what's going to be heavy on the test or whatever. And like the content that you need to know this stuff, but you're not going to be able to remember everything. That's just period. That's not happening. So you definitely need to take notes, highlight the most important things. Even when you're going back and you're taking your practice quizzes on Evolve or whatever ATI, whatever site that your school uses, go through and write down what I need to practice a little bit more on that. I need to go back to that subject that she spoke on in that PowerPoint. One way that I created my study guides was I took the PowerPoint, which is what the teacher or what the professor lectured on, and I created it into a Word doc. So literally in PowerPoint, Microsoft PowerPoint, you can go in and go to export and change it into an outline. Outline changes it into a Word doc, and you can create your study guide, because all the words is going to be word for word, literally everything, unless it's a picture. It's not going to transfer into the Microsoft Word. But even then, you can copy and paste your pictures or your graphs or anything that they had in the PowerPoint and put that into your study guide. I definitely did that, and that's how I studied for all of my tests. When I tell you, because it's regardless, it's word for word, it's everything that the teacher wanted you to know. I took out stuff that, I already know this information, or like kind of not irrelevant, but irrelevant information to my test, or that I need to know. And then I would even add little notes that helps me remember things, color code things, make things highlighted yellow, bolded red, bolded whatever color you want to do, to know when you're reading over this information, I need to really pay attention to this. You're definitely going to have to learn how to do a head-to-toe assessment. Return demonstration, I'm sure most schools have you do that, whether it's a live virtually with a meeting with your teacher, or whether you have to record yourself doing the video, or whether it's going into the school to do it. Your head to toe or your head to chest, do not, I repeat, do not post your return demo sheet up somewhere, and while you're doing it, doing your videos, look at it and then try to do word for word. Do not do that, because you're not going to benefit yourself. This is literally what you're going to be doing. You need to develop your routine as to how you're going to be assessing your patient. So practice. Literally, I practice on myself. I do not care. I'm going to sit here. Hi, my name is Kyla. I'll be your nurse today. Are you having any? Can you tell me your first name, last name, date of birth? Okay, I'll be here doing an assessment today. It'll take about 20 minutes. Do you have any allergies? Can you tell me why you're here? What the year is? Where are you at right now? Literally, I'm just going through and I'm saying how I'm going to be talking to my patient. All right, I'm going to go ahead and fill on your head here. All right, it's normocephalic. All right, I'm looking at your eyes. Okay, the conjunctiva is pink. The sclera is white. All right, you have some normal nasal patency. All the teeth are intact. Your mucous membranes are moist. You know, I'm literally saying it out loud. Like, this is what I need to be looking at with my patient. The skin turgor is well. The skin is warm. There's no edema. There's even hair distribution. I'm definitely saying it out loud, like repeating it. Even when I'm on FaceTime, my friend's like, all right, let me go ahead and go over my assessment with you. Even if I'm just doing it on myself and I'm telling, you know, I'm talking to my patient, all right, I'm going to be looking for this, you know, your ears, there's no drainage, there's no redness, there's no swelling. All right, there's no any rigidity or no feelings of muscle mass here on your abdomen. You know, I'm just because I'm familiarizing myself with like what I need to be looking at with each system. All right, go ahead, squeeze my hand, push up against my arms, you know, just little stuff. Talking it out really helps. Practicing really helps because you're going to have to get into your groove of what you're going to be doing. Don't read it word for word verbatim of what your return demo sheet says. Because when you get ready to assess your patient, you're not going to be all right. So, the eyes, the ears, the nose. You maybe need to do a focus assessment. Or if you are doing your head to toe, this patient is not going to be cooperative. Like, okay, first I'm going to look at, no. No. So I would definitely say really practice, like dead serious. If you're just, even if you're in a shower, all right, my name is Kyla. I'm telling y'all, like, I don't care. I look crazy as hell walking around my house talking to myself like, okay, go ahead, stand up. All right, flex your hands up, flex them down, palms up, palms down. Like, I don't care. But I'm practicing now. Like, this is what I need to be knowing. This is gonna be my future. I can't go, ooh, shit, I forgot to listen to their heart. The most important part of my fucking assessment, their heart for chest pain, like, because I'm too busy thinking about my return demo sheet. No. You definitely need to practice. Like, I'm not even kidding, y'all. Don't wait till the last minute either. Yeah, so overall, basically with health assessment and funds, you definitely need to know your basics. Like, literally know the basic vital signs, know the normal heart sounds, know the normal lung sounds, and then you need to turn around what would be abnormal. Crackling in the lungs, the whistle in the lungs, like this beat when I'm listening, this turbulence that I'm hearing when I'm listening to the carotid artery. Literally know your basics. And like, it also helps, like, if you have a little bit of medical background. I know that's helped me, but even if you don't, like, this is very much so doable. Like, it is very much so doable because I'm in the medical field, but a lot of this is still new. I've been in the medical field for like 11 years, 10 years. And a lot of this is still new to me. And it's okay. Like, it's gonna be days that you're gonna want to cry. You're gonna scream. You want to fucking quit. Like, that first session, like, I was done. Like, y'all don't even know how many videos I tried to do to record or edit. Like, I tried. So you definitely need to practice your skills, figure out what type of learner you are, utilize your resources. Literally, when you're talking to your friends, go ahead and like, all right, so say I have this young adult and I have this extra beat. I hear lub dub dub. Is that normal for them? Or what type of heart sound is that? Okay, well, that's an S3 heart sound. And you hear it after S2, but he's a young adult, which is normal. So, like, you know, little conversations, talking with your friends, like, that helped me on FaceTime. And organizing my study guides, by each section, definitely making a study guide after each lecture. A lot of us don't have the luxury of, you know, having enough time to study. So I definitely am going to do a video about working in nursing school, because I've had a huge life change with working since I've been in nursing school. But that's going to be a separate video. But I'm definitely going to sit here and tell you, like, you have to make time to create your study material, and you have to have time to study your study material. You have to have study material. It's just, you're not just going to be able to walk into the test and just do well. You're not. You're definitely not. Of course, you already know how I feel about getting in my planner, period, writing everything down in the planner, checking it off when I get it done. It feels great. Your homework, I literally did my homework at the beginning of the week, so for the weekend I can be chill and just reviewing my information. I'm not stressing about shit, I gotta turn this assignment in by 11:59 on Saturday. No. Like, I'm not stressing myself like that. I'm doing it at the beginning of the week. My HCI assignments, I'm listening to them, and I may be working on stuff. I may be on another split screen and I'm doing my study guide, but I'm also listening to my HCI assignment about my catheter insertions or my NG tube insertions, my IV insertions, or listening about the nursing process. I'm listening, however, I'm still multitasking at the same time and creating my study material. Like, you have got to utilize your sources, utilize your time, sources as in using your, we have a cast, like, or a student, like, support, to meet with them, remediate your test, talk with your friends, bouncing off other ideas with them as well. Like, that's definitely gonna help. It may seem like I don't have time for this, but you know, you can, it's not, doesn't have to just simply be just about studying your material when you're talking to them. Like, we'll be talking about stuff and next thing you know, we both on Instagram scrolling, like, and that's okay. Like, it's okay to have a break. It's okay to have a break. Like, that's cool. Definitely funds and health assessment, it was very interesting. This is just like getting my foot in the water, like, to know that I'm going to my specialties next. Like, it's all fun and games from here. But yeah, that was definitely how I got through surviving health assessment and funds. Like, it was a lot easier this last session because I found how I learned. Like, I knew that reviewing my study guides over and over, writing my little notes, rewatching my lectures, that's how I learned. Reviewing the registered RN videos about how to do my assessments helped me personalize my assessments with my patients. I ended up with a B both sessions in funds. Like, I hate it. Y'all, I can't even talk about it. Like, I can't even talk about it. I could have done a lot better, but that's a story for another thing. About how my experience went with funds. But I got a B. And then the first session of health assessment, I got a B, and then this last session I got an A. My B's definitely could have been A's. I fucked up a little bit, but I mean, I'm not perfect. So, but it's definitely doable. Like, dead ass serious. Like, even with me fucking up on one test at the very beginning, like, and I had to like truck my way. I didn't fuck up. I got a C, whatever. But you know, I don't do C's. Like, I'm so competitive, y'all. It's horrible. But I need to realize that knowing the content is way more important than, oh, I gotta have a 4.0 GPA. Like, that's what I need to realize. I'm not gonna have a 4.0 GPA. But anyways, so yeah, that was how I got through surviving funds, surviving health assessments, how I got through. It was not bad. It's definitely doable, period. Like, with working, with life trials, like, it's doable. You can do this. Literally, you can do this. So yeah, Thanks for watching. I hope I was very helpful with you guys. I'm gonna be trying to post more. Follow my Instagram, the THEE Radiant Nurse. Follow that. I will be having little more reels and stuff like that on there, more inspirational posts, my apparel as well. That's coming soon. That'll be a separate video. So yeah, I hope this is helpful. Stay tuned for the next video. Thanks for watching. I will be back soon. I'm not gonna ghost y'all. And good luck with y'all next session. I hope everybody, unless you're not in the summer session, but of course I'm still with my Saturday program, I will be there. I will be in school. But if not, enjoy your break. Live your life. It's hot girl summer, hot boy summer. We out here living life, period. Stay safe in these streets. And of course, if y'all ever need anything, feel free to email me at theeradiantnurse@gmail.com. Hit me up on Instagram. Follow me. Y'all got this, nursing students.